Okay. So, very good afternoon. Last we started with Asteria. So, any quick questions in Asteria? Must be we spoke a part of Asteria, and the remaining part we'll try to cover today. So, what was discussed already? So, if you can recall what was already told to you in Asteria, we can build a picture, and it will be easy for us to understand. Okay. So, what is it that we had discussed in the last class? Okay. So, what is it that we had discussed about Asteria? Okay, there was Korea. Yes, agreed. Apart from Korea, it's a left-sided remedy.
Ulcerative stage of cancer.
Okay, so cancer, and in cancer, when do we think of Asterias rubensis? During ulceration, and cancer mainly of mammary. So that is what we'll be mainly focusing in today's class. Okay, good. Other than cancer.
Twitching or depression 3-4 days before.
Okay, epilepsy, convulsions, wherein you have twitching. Chorea better by keeping hands in the pocket. Correct. Yes, good. So,
Acts on the lower GI.
acts on the lower GI. Yes. So what we saw was more of constipation, and we also saw more of diarrhea. Yes. Olive legs too. Ball-like, round, olive leg. And I told you probably only remedy mentioned in the Media Medica for stools which are olive-like is Asterias rubens. Good. Okay. Anything else?
And gushing out diarrhea.
Okay, diarrhea, which is they cannot have control, and patient has to rush. Gushing stools. Okay. Yes. Good. Acne in adults. So disposition for acne, especially in adults. Yeah, that's what even she was trying to tell in the last class. Acne. Okay, anything else?
Aversion to meat.
Yeah, we had some characteristic desires and characteristic aversions. Okay, very good. So, having recalled few characteristic symptoms, we'll see how that information we can take it further. See, in today's class, I'll be mainly focusing on two areas. Okay? Or probably little of mind of Asterias also will try to understand, but the main focus will be on the nervous system, okay, and we'll also focus on another area, and that is the female genitalia, okay. So two areas is what we'll be focusing. See, nerves, you already know, Asterias acts on nerves, and it mainly causes three very important things. One is chorea, twitching, you spoke of chorea, epilepsy, and the other very important thing is neuralgia. So three things is what you see in Asterias rubens, okay? And the second area for today's afternoon will be its action on the female genitalia. Main focus will be on the uterus, and will be exclusively focusing on the breast. Cancerous affections of Asterias rubens. And I told you, if time permits, we'll also talk of mind. Though it is not a very, explored area, we'll also try to touch the mental symptoms of starfish. Okay. See, focusing on the nerves. In last class, I have given you different remedies. Like for example, we spoke of cupram, we spoke of bufo, lot of similar remedies related to convergence, aura, okay? And the aura that we saw here is, what is the aura? Twitching. Twitching is one thing we discussed. They have excessive twitching, especially 4 to 5 days before a convulsive attack. Not only twitching, they can also be emotionally very irritable. Irritability before convulsions are more seen or more prominent will be the twitching 4 to 5 days before the attack. That's one thing. And after attack, what you see here is they go into great prostration and a kind of a distress in the abdomen. Discomfort or distress in the abdomen after convulsions. Okay. If If you remember, I was sharing a case of a boy who had first episode of convulsions, and then this boy, after convulsions, he went into a lot of anger. And if you remember the rubric we had taken, there was a beautiful emotional thing, ailments from ambition deceived. He wanted to become something, and unfortunately he did not reach his ambition, and while traveling on a two-wheeler, first time in his life he threw a convulsion. And when people were all surrounding, and after conversion he became very angry after an attack. So two rubrics were taken, ailments, ambition deceived from, and the second rubric we had taken was anger conversions after. And when we combined, you get Naxvamika Platina. And keeping his nature, keeping what all the events happened, he was given Naxvamika. No further attacks, he is doing very healthy. I mean, no attacks. No allopathy, all the investigations also were normal. Though he was advised some anti-epileptic remedies, we had an understanding with the patient very systematically and very genuinely, because it's also a responsibility, because you are dealing with a very young boy. Okay, so very meticulously we had planned his case, and we did not start the anti-epileptic remedies prescribed by our allopathic friend. And he was beautifully managed only with homeopathic remedies. So what happens before convulsions, what happens after convulsions or during convulsions, all those will help you in building up a totality. Though I do not have many cases of convulsions, few cases. Recently one of our staff's brother, he is a non-epileptic, he had a lot of EEG changes, and after the right remedy we got his EEG done again recently, and EEG shows normal. Okay, so though I am not a master in treating convulsions, whatever minimum cases we have, we see good results. There are few failures also, I don't deny, but if you are lucky, they come directly to you, or sometimes they might come taking allopathy and they want to taper allopathic remedies. Okay, so your plan will be different. In this boy, it was new case. We could treat only with our medicines, not giving allopathy. In this case, he is on allopathic medicines. In spite of that, he used to have attacks. Okay, and now he is due for his visit with the neurologist, and the neurologist will be a better judge to taper the allopathic medicines. It's not our field. Okay, but at least EEG, which was showing changes, at least after homeopathy, EEG is normal. Okay. Anyway, we will come back to this remedy, starfish, before and after, what happens, very important. And then we also saw, one of your friend was telling Korea. Okay, those involuntary movements. And what we also saw was that pitching, the involuntary movements are quiet when he keeps his hands in the pocket. Okay, and I told you this was contributed by a great homeopath, Indian homeopath, Dr. Phatak. You have it in his material medica, this particular symptom. Okay, so chorea quite only when hands are in pocket. This is a very, very important symptom. And if you are lucky, it's a single remedy, so it's very, very easy. Okay, so we also saw the other things, gait, and we were trying to understand the gelsemium in the last class. Gait, which is unsteady, and muscles refuse to obey the will. And I also tried to tell you in the last class, everything is physiological. For example, the movement that I make, the head that you are nodding, fine? It's all a neurological thing which is happening. The impulse goes there, and then from your physiology. So what is happening here is, your will says move your hand. Okay, fine. But what is happening in Asterias? So the muscles are not obeying the will. For example, you want to put your foot forward, but this is not happening. It might go the other way, or it might go to the other direction. So that coordination is something that is going to miss. Right? Yeah, better remedies. What is it? Gelsemium. I suggest gelsemium. Alumina, argentum, cocculus, agaricus. Right? Where these coordinations are missing. Ataxia, cerebrospinal ataxia. They're beautiful remedies you can think of. Okay. So unsteady gait, and this is related to the neurological part. Now we look at the important part, okay, which clinically it has been verified, observed, and that is the female. So female, I'll tell you two symptoms, and then immediately we'll talk of the breast symptoms, which are very important. Okay. So female, what you see here is there is increased sexual desire. Okay, increased sexual desire. So any other remedies that comes to your mind? Murex, platina, lilium tick. Yes, agreed. Murex, platina, lilium tick, calibro, Agnes. Okay, Ambra. Okay. Lacasis, yes, Lacasis, agreed. Fine. Conium. Don't forget conium. Recently we had a case, okay, of an elderly lady. I couldn't explain this to the students, but then anyway, this is a beautiful scenario. Sexual suppression in women during menopause. Okay, remember this. Ladies attaining menopause 45, 55, whatever. I will not bother about the age, but that menopausal time, and when she is missing the physical relationship, and then she lands up with some complaints. Generally they will have vertigo. Remember, a menopausal lady talking of vertigo, and here all the reports are normal. Fine. So then you can just very gently, very, in a very ethical way, you can just ask for the physical relationship, taking the lady into confidence. Husband is traveling, husband is missing, and she is missing the husband, she is missing the act. For example, if you get this situation, the only remedy we have in our materia medica is conium. I learned this from Vijaykrishna, and I have seen in many of the cases, okay, beautifully it works. So if you get it, don't hesitate, don't doubt, you can think of conium. Okay, so conium, even that rare remedy, OR, oregano. No. See, Arnatha Mobulatum is for siesta. Anasumonium is something different. Oregano. Now what happens in oregano? I told you, there will be sensation as if worms are moving. Or I also gave you a situation where, for example, thighs rubbing, or they masturbate by rubbing the thighs. Fine? And that sensation of worms leading to masturbation is also seen in caladium. Caladium. Okay. Increased sexual desire. Fine. But the situation you have in Asteria rubens is sexual desire not better by caution. That's what makes it characteristic. Increased sexual desire not better by caution. Increased sexual desire aggravation caution is tarantula. Increased sexual desire, but aggravation caution is tarantula. Okay. So this is one symptom, and you can also see growth in the uterus. But growth in Asterias, you see it in a different area. Now before I go to that particular area, I just want you to contribute, this being a post-run session, I just want you to make some noise, make some sound and contribute the remedies for cancer. Okay, calendula. No, I mean, I'm happy Brahmara is talking about calendula. I was searching, I was preparing for a remedy Condurango, which will come up. And there I came across calendula. Now what is that speciality you have in calendula when it comes to cancer?
Intercurrent.
Okay, it can be used as an intercurrent. Okay. Cancer pains. And what I found in the repertory, single remedy, was hematemesis in CS stomach. When the patient is vomiting only blood in CS stomach. Okay, so I mean, coffee ground vomiting is something which is a common symptom. But when they are vomiting only blood, so the remedy, single remedy mentioned in your repertory is calendula. Okay? So calendula can be used as an intercurrent, I don't deny, for cancer pains. And of course, please also add this, that for vomiting, in vomiting of blood in case of CS stomach. Good. So we have calendula and of course, what are the other remedies? Bismuth, conium, bufo, hydrastis, euphorbinum. What is it for?
For cancer pains.
Pains. It is mainly for pains.
Citric acid.
And I also had something told in euphorbinum, very characteristic. For ulcer pains, cancer pains it is there. But CS stomach there is something very interesting in euphorbinum. Burning, must be some pain, burning pain in ulcers, in APD. I took a topic very recently, but I'm not able to recall. There's something I'll just check and let you know. But for cancer pains, you can think of euphorbinum. Then rota mainly for CA rectum, phytolacca mainly for glands. Breast anyway, phytolacca will take it up. Hecla lava mainly for jaw. Okay. Then ornament. Ornament.
Facial bones, sinus cancer.
Aurum nasal bones. Okay. Then gallium. Okay. Good. Cadmium sulfate. See, cadmium sulfate is a beautiful remedy. Especially CS stomach when you have all those vomiting. Fine. Cadmium. Radium brome. When do you think of radium brome? Especially, if patient is diagnosed with cancer and they're undergoing radio, chemo and all, for the bad effects, you can think of X-ray, you can think of radium brome. Okay. One of my friend is in Surat. He extensively practices only, he treats only cancer patients and he's got very good results. Fine. So anyway, we'll come back. What I was trying to tell you is my experience with cancer is limited if you are looking at cases, but then we'll do justice to the given topic. Okay, so what we need to understand here is, you told me so many remedies for cancer. Now I want to go more into a specific area. Whatever you have spoken is in general. And the approach for cancer also is something different. Each of us, we have our own way of looking at cancer. Okay, but what you also need to understand is, we are looking at a specific organ. Okay, we are looking at a specific gland. Fine? So if I ask you a question, which are all the remedies for CA breast? CA breast. So what are all the remedies that will come up? Conium, phytolacca, Asterias, yes, it's there. Badiaga, bufo, fine, and then carbonimalis. Don't forget carbonimalis. I'll give you the indication, beautiful remedy. And you also have graphites, murk, silicea. These are 3 mark remedies taken from your repertory. And you also have many remedies, but few more important remedies will be hydrastis, phytolacca, arseod. See, I was expecting bellies from you. Bellies. And you see a surprise here, Lacan. Any vague idea? When do we think of Lacan We will talk about it a little later. Sulfur and of course the remedy that we are discussing today, starfish. Okay. So we'll primarily focus on Asterias rubens and then we'll take a few remedies for comparison. Okay. Now I told you from the time of Hippocrates, this is a remedy which has been used for tumors. And then homeopathically it was verified and they have been using it as a remedy for CA breast. Now what are the indications of starfish in CA breast? First thing is left-sided. So left side, yes, agreed. Then so if you are looking at, we were also looking at that, what is it, TNM, tumor node metastasis. How big the tumor is, how many nodes are involved, is the tumor metastasized to different organs. Based on this, you have this classification, TNM classification. I am not going into the details, but as a homeopath, you should also be aware, fine, in TNM, for example, first grade, second grade, whatever you talk of. So what remedies can be thought of? And that will help us in understanding where we can think of the different cancer remedies. Okay? So if you are looking at the stage part, it is mainly thought of in the ulcerative stage. And ulcerative stage, from your knowledge of pathology, is something that happens later. I hope I am clear. So you have more of a growth. From the miasmatic point of view, it is more of a psychosis, induration, and this induration, as the disease progresses, it goes into ulceration. Okay. So they say even at this stage of ulcers, or the ulcerative stage, one can think of Asteria rubens. Okay. So moving further, cancer of mammary. I am just giving you the indications. Cancer of mammary, especially the left breast, very important. And then nodules and indurations in the mammary. Fine, there are part and parcel of cancer. What is more individualistic in Asterias? When do you think of Asteria rubens is when they have lancinating pains. And the pains which are more at night. I was cross-checking in your repertory. Pain, nightly aggravation, single remedy mentioned is Asteria rubens. So tomorrow you have a lady with CA breast, she's got pains and she says, day I'm okay doctor, but nights I've got more pains. It's left-sided. One remedy that should come to your mind is this. Okay. So feels as if breast or nipple is drawn back. Again, if you read your surgery, you will realize the importance of all this. Intra nipple. Okay. So which stage, all those things is what you'll have to understand. So this is one part, and then you have something very characteristic. Pain in the left breast, which radiates to the tip of the little finger. Pain extends from the left mammary through the arm. It is not of cardiac origin, it is because of the CA. Clear? Because we don't have much literature related to Asteria rubens acting on the heart. So don't confuse this symptom to the heart pathology. Okay? Fine? MI, angina, pain from heart, pain from chest radiating to the finger. This is mainly in the breast cancer. Okay? So ulcerative thing, and you also see we are talking of TNM, tumor node. So what you see is the lymph nodes in the axillary lymph nodes in Asterias rubens. They are all hard, knotted, and swollen. Okay, swollen, knotted, and hard. And I've just taken it from Google image so that you can understand how the drainage is happening, fine, how the lymphatic drainage is happening, and how these things are getting involved. Okay. Cancer of mammary, this is what you started with, and this is what I am ending with. In the indications of Asteria rubens, that ulcerative stage is where one can think of Asteria rubens. Okay, so this is about Asteria rubens. Now a little about mind, though I don't have a PPT prepared. What you see is basically they have fear of apoplexy and delusion, as if they are away from home, as if they are among strangers, and as if strangers are controlling them. So this is the delusion you have in this particular remedy. Okay? Very irritable, angry, contradiction aggravates, especially convulsions, aggravation, contradiction. So there is an emotional angle also in Asteria rubens towards convulsions. Convulsions, aggravation, contradiction. Okay? Now we'll take up a few remedies. Now cirrus is a word, and if you, I hope you, I know you'll be aware of it, but what does this mean is the tumor, the cancerous growth is very hard. Okay, fine. So then we use a general term called as cirrus. Okay. So a cancer that is hard to touch is the first thing, and hard as a cartilage. I'm explaining the tumor of a tumor breast in a remedy. Okay. So hard as a cartilage, it is indurated, you know that, and the swelling is uneven. The swelling is uneven. From contusion, and the axillary lymph nodes are enlarged and they're hard. Okay. Phytolacca is what Shubha is trying to tell. Any other contribution? Conium? Any other contribution? So, in Phytolacca you will not have it from contusion. A remedy which has CA breast from contusions, though there are many, the remedy that tops the list is conium. Okay, good, conium. So conium is a beautiful remedy for CA breast. It's not at the ulcerative stage, it is before the ulcer set in, when you have more of hardness, when you have more of induration. Okay, what is it? CA breast in young widows, CA breast in women who have suppressed sexual desire. Okay, you can think of conium. Discharges which are offensive. See, from the cancerous breast you have discharges which are very offensive, and discharges, gangrene, tumor with gangrene. Tumor which is turning gangrenous. Probably you can also relate why it is so offensive. That the tumor is also going into gangrene. I am talking about breast tumor, not tumor in general. Breast tumor, when the discharges are offensive, breast tumor which can go into gangrene, okay, and breast tumor which is generally seen in old people, and breast tumor which is seen in the last stage. Okay, carbo animalis, very good. Drawing pain and drawing, burning towards axilla, burning pain and drawing towards axilla with dirty bluish look, and the skin is very loose. Okay, and you guess the remedy, right? And the remedy is carbo animalis. Carbo animalis. Okay, so in repertory it is given 2 marks under breast cancer, breast cancer. But you see a lot of things which are very, very prominent, very, very special, very characteristic to this particular remedy, carbo animalis. Last stage, in old people, which can turn gangrenous and with aggressive discharges. 4 characteristic symptoms, and only remedy mentioned is carbo animalis. Okay? Epithelioma, and there is also burning pain. Karthik was shouting one remedy. Okay, and I counted another remedy. The remedy is before. Okay? Right sided, again you have cirrus, even after ulcers have set in. Now tell me the difference between Asteria and this particular remedy. Huh? No, I want the difference. I know you answer the remedy. I'm just playing with your confidence. You are preparing the remedy and I am asking you the difference. And Shilpa is right, the remedy is hydrostasis. In Asteria, it is left side, hydrostasis, it is the right breast that gets affected. Okay? And like for example, you have ulcers and you also have that hardness and hydrostasis canadensis. Right sided, when you have lancinating pains, jerky pains. Okay? And the remedy is Phytolacca. Phytolacca. See a breast after injury. One more remedy. Hypericum. See, you also have another subheading there. See a breast, contusion strong. Okay, there, for example, you have after a blow. There, you have arnica, you have ruta, you have conium, and you also have bellis. All the injury remedies. Arnica, bellis, ruta, conium. Okay. After mastectomy of opposite cancerous mammae. Please understand the statement given. So for example, a lady had right-sided CA breast. Fine. So this CA breast has been operated and it been removed. Now she is developing CA breast in the left breast. Okay. So the surface remedy is only remedy mentioned in your repertory. Only remedy mentioned in your repertory is Lacan. And Lacan also has a lot of alternative changing things. So right she got, right it was removed and then it comes to the left. Okay, Lacan. Many times we have patients coming and see like, that's what I was trying to tell you, our approach is different. But please have every information. You never know what can be handy. You can have your own mind-body approach or you can have a specific particular approach. Ultimately, what is important for us is the patient's well-being. Okay? All cases, we may not get mind-body. Though you are very sure nothing happens without mind, but sometimes you are in a fix, you are not getting mind-body. Okay? Then sometimes you may also have to prescribe on a particular totality. Fine? For example, the hardness, where it is, which is the organ that is affected, fine, which is the tissue. Then you may have to prepare a small acute totality, a small totality, particular totality, and you may have to prescribe. So keep everything handy. If a lady is giving you a conflict, right breast, left breast, which part is affected, you can tell the conflict. But she says nothing like that, sir. Then you may have to think of a particular totality and prescribe. There's nothing wrong. Okay. So the last part here, hope I am clear. We have also taken a few remedies for comparison. The last part is the modalities. Any wild guess what the modalities are? Night aggravation is good. Left-sided. And 2 to 3 p.m. 2 to 3 p.m. I also told you convulsions, aggravation, contradiction. So coffee, night, left side, contradiction, 2 to 3 p.m. during menses. These are all the modalities. Okay. So last 2-3 minutes, what we understood in Asterias rubens is its affinity for female nerves, GA. Okay. And of course skin. Skin also you see a lot of symptoms. Like for example, you have ulcers with foul discharges, acne. What your friend was contributing, acne is a very good remedy, especially in adolescence. Okay. And we also saw that twitching, that left-sided affinity, those stools which were round, obstinate constipation, olive-like stool, and of course we also had that gushing diarrhea, right? Okay. And mentally we also saw that there is a lot of fear and delusion that He is not at home, he is controlled by strangers or he is among strangers. Okay? And again a very angry constitution, they will not like contradiction. They will not like contradiction. Okay? Anything else to add? So to conclude, we have taken up few CA breast remedies specifically and we also compared. Though there are many more remedies, I mean keeping the time limitation, I have just given you few. You can always, as a PG scholar, you can always go back home and refer good source books and you can make a note of your own. Okay, so any quick questions? Okay, assuming this is clear, we'll next class we'll start off with no source. So what no source are and what are all the indications of no source, common no source, and whatever no source are there in your syllabus, we'll slowly start understanding each of them. Okay, so thank you.